everyone, I'm Dr. Nisha Vishnu, a radiation oncologist practicing at Fortis Hospital, Bannerghatta Road. Today, I'll be discussing a few points on self-breast examination, which is a small way by which you can contribute towards your breast health and well-being. The name is self-explanatory, self-breast examination, which means you are examining your own breast at the comfort of your own place. Of course, it is not a replacement for your doctor's visit or prescribed tests such as mammogram or ultrasound, but it is something that can help you to identify problems much earlier. So here is how self-breast examination is done. There are two parts of this examination. First is inspection, wherein you stand comfortably after undressing in front of a mirror, with both the hands placed over the hips, and looks for the following changes. Any change in the symmetry, size and shape of one breast in comparison to the other. Please note that normally our two breasts are slightly different from each other, but in case you note a gross difference, then you should go to your doctor. Any visible lump or skin puckering or dimpling, any gross venous engorgement or change in the color over the breast surface, nipples pulled inwards or any secretions from the same, and then you can repeat the same by putting your hands up above the head. The next part of the examination is palpation, which means to feel for any abnormalities, and this is usually done by lying down comfortably on any flat surface with the pulp of your 3 fingers. You have to feel all the parts of the breast by gently pressing it in a circular or a radial fashion from nipple outwards. Please use 3 pressures, mild, medium and deep, and make sure you cover all the aspects of the breast. Please do not forget to include the underarms, that is the axilla, which could harbor swellings that is indicative of abnormalities. When to do a self-breast examination for a premenopausal woman, it is ideal to do it after a week of the commencement of the periods. For a postmenopausal woman, she can pick and mark any day of the calendar and stick to it. So what if you pick up something? Don't worry, 80% of the time these are benign, that is, these are not harmful. Just visit a gynecologist or your oncologist so that they can take it from there. That's it for now. Please stay tuned for more on breast health and cancer prevention.